Hello everyone, my name is Christine Kim, and today I'll be presenting on HIV, talking about how it is transmitted, and some of the ways and the modes of transmission of HIV. I'm a student at ASU studying biology with minor in Spanish and global health, and I am a pre-med student who hope to go into medical school to study neurological diseases. I really enjoy learning either through research, seminars, books, discussions, and recently I've been taking a course with Dr. Salmon, Dr. Jacobs to learn more about HIV, the way that they are transmitted, prevented, and just more about the disease itself and how to communicate this information effectively. So that's what I will be presenting about today. So thank you so much for being here and for your time. And as I'm presenting, please feel free to use the bathroom if you need to, which is just outside the door right there. So first to start, to introduce more about HIV transmission, we can organize this information into 5 fluids and 4 doors. So to start with 5 fluids, there are 5 fluids involved with the transmission of HIV. Number 1 is blood, 2, vaginal secretions, number 3, breast milk, 4, semen, and 5, pre-ejaculate. And to kind of go more into number 4 fluid, semen, it is good to know that there's a difference between sperm and semen. So semen contains sperm in the fluid, but sperm itself does not carry or transmit HIV. Only the fluid of semen itself is what is able to transfer HIV from a person to another person. And now that we have established what the fluids are, now we're going to talk about what the doors are that these fluids can enter to transmit HIV. Number 1, we have vagina. Number 2, open wounds. Number 3, tip of the penis. And number 4, anus. So in any of the fluids, the 5 types of fluids that we talked about enter through any of these 4 doors, HIV can be transmitted from one person to another. And now that we have established the fluids and the doors that they enter to transmit HIV, now let's talk about the modes of transmission, how this entering a fluid into these doors can happen. Number 1 is unprotected sex, and I feel like this would be the most well-known mode of transmission of HIV, and it is also the most common mode of transmission. So if you think about it, there's actually a lot of doors and fluids involved with unprotected sex. Some of the fluids that might be involved are vaginal secretions, semen, pre-ejaculate, and possibly blood. And some of the doors that might be involved with unprotected sex is vagina, teeth of the penis, anus, open wounds. So all of the 4 doors. Number 2 mode of transmission is mother to child. And this mode of transmission actually has a few scenarios where it can happen. Number 1 is breastfeeding, and it is a very common cause of HIV transmission. And in this mode of transmission, the fluids that are involved are breast milk and blood. And a common misconception is that the door to this HIV transmission is the mouth of the baby who is getting breastfed. However, it is actually open wounds. Mouth is not a door to HIV transmission, but it is the open wounds inside the baby's mouth or their gum that would be the door to HIV transmission. Number 2 scenario with this mode of transmission is during birth. So the fluids that are involved with giving birth is blood and vaginal secretions, and this happens when a baby's coming out of the birth canal and there are micro tears in the baby's skin. So in this case, the door would be open wound again. And lastly, another scenario for this mode of transmission, it is rare, but it is in the womb. So the fluids that are involved is blood, and the door will be open wounds on the baby, and this can sometimes happen in the wound before birth. And number 3 mode of transmission is blood to blood. And obviously, the fluid that is involved in this mode of transmission is blood, and the door is open wounds. And this mode of transmission of HIV can be common among injection of drug users. So this is where blood to blood HIV transmission can happen. An important thing to note in this HIV transmission and any mode of transmission or scenarios is that the fluid must be wet for this transmission to happen. So if any of the fluids are dried up, the HIV is no longer survives in the fluid, and even if that dry fluid enters a door, that would not transmit HIV. Thank you so much for listening to my presentation on HIV transmission, and I hope that was helpful.